Welcome everybody to the 11th meetup of the Mental Health Innovation Network. Is about building bridges and helping innovation to thrive. We do now have a good representation within the network. We have healthcare providers, patient organisations and charities, investors, academic organisations, funders.
What we're trying to do with events like this, partnerships and collaboration, is to try and make an improvement, to make a difference. We want to make this space to be known as the home of health tech.
Today is a showcase of partnerships in action, helping scale mental health innovation.
We provide a platform to the NHS and to the Priory Group that supports triage, assessment and diagnosis.
Everybody rings the Priory and was wanting to see a psychiatrist. We were able to use the Psyomics platform to demonstrate that actually therapy was often the best course of action. So it really helped prove that concept and move that forward.
Vitality, one of the largest health insurers in the UK, we started to have member confusion, people ending up in the wrong place at the wrong time. The partnership with Wiser was really to start to tackle some of these problems. We have a lot of partners approach us and say, hey, we can work with you, we'll just plug in an API. And that might sound easy for you, for us, is simply huge.
We've built a completely customised app. It's linked all back into the Vitality My Care Hub.
We're a mental health and community health service provider. The partnership vision was to automate the medication request and supply process.
EPMA wasn't really a thing 25 years ago. It's now very important, and people are wanting our software to very much integrate and help with their workflows.
This is a team sport. Integration really needs cross-functional input. What is it that's actually helped us make this vision a reality? It's the power of partnership.
The only way to create symphony is to let each maestro play their own instrument. So what does the symphony creation in digital mental health looks like? We need industry to be in the room, authentic inclusion of people with the lived experience. If it does not work for the person with the lived experience, their families and the carers, then it does not work at all.
It's so easy to come to conversations like this and to just focus on how hard it is to get innovation into the NHS.
We work with a lot of talking therapy services to deal with their waiting lists. For people where we provide the right culturally appropriate therapist that speaks their language, they access that care much more.
By enabling patients to do more of the therapeutic work in between sessions, we're looking to achieve the same, if not hopefully better outcomes with fewer appointments. Our algorithms guide them to and ultimately through an evidence-based activity that is in line with the work that they've been doing with their therapist.
Self-harm also over-indexes towards marginalized communities. We see a lot more neurodiverse population, a lot more young women. We decided that instead of plotting holes in a broken system, we will partner with the health system and redesign what care should look like.
There are so many different people that you might have to engage with. Some of the companies that I've worked with that have done well, they've been really good at connecting those people up within the same organisation sometimes.
It's also about that flexibility within developmental partnerships between innovation and NHS trusts. It isn't quite working in a traditional hierarchical model.
Unless you're a product that's creating a cash releasing gain, you will be pushed into some kind of price erosion. There just is no more budgets to do this.
Supporting the carers that keep people well most of the time, that's one of the ways in which the NHS ultimately is going to become more efficient.
At the early stage, it's essential to think about system need and user need as well. But of course, early stage ends and you need to get commercial funding.
How do you scale that, and how do you get beyond kind of one NHS trust or a couple of schools?
How do some of these things come together? And that's not necessarily going to happen in day one of your journey.
There will be a point of consolidation. We're seeing it in health tech now.
If we can carry on this level of innovation in a way that addresses inequities rather than exacerbating them, then that's something to get really excited about.
How do you get evidence-based innovations adopted at scale to benefit patients and clinicians in the NHS? Clinicians want tools to help them do their jobs better. And when you can really, really tap into that energy, I think it could be such a powerful force.
Where I think we're heading in mental health is turning products into services, because that makes it, I think, much easier to procure.
If anyone is coming into a program, for example, like the NHS Innovation Accelerator, the founders, the ones that have scaled really well, they all have very similar traits, grit and determination, and because this takes a very long time.
We support companies build programs that sell markets and generate revenue without having to use the UK, because we know the NHS is quite challenging. The types of things that we think are a given in another part of the world are not.
And actually there is always scope to kind of define a value proposition.
Any new innovation coming in has to serve the entire population equally well from day one. And at that bar, nothing gets adopted.
My plea to people in the room is just keep in the back of your mind, are we ever going to get to people who do rely on NHS services or are really underserved by the majority of these companies? When you think back and you see the way that the technology has come on and the products have come on and how they are really meeting users' needs, I think it's just amazing how far the sector has come.